Welcome to Cyprus Facial Surgery. Hello, my name is Dr. Dimitriadis. I'm an oral and maxillofacial surgeon and a facial cosmetic surgeon. Today's video is about facelift and cosmetic surgery in general. This is an informative video about who is a candidate for facelift, who needs to go through this procedure, what are the benefits and the aesthetics benefits of this procedure, and what should you expect after this procedure. In general, before we understand the procedure of facelift, we need to understand who is a candidate for facelift. Aging process is a process that continues over the years with different effects on the face. One of the effects of the face is the facial ptosis. As we age, we lose volume from the face, we lose structure of the face, and soft tissue migrates from the clavicular forces downwards, and they create excess skin on the lower part of the face. As an effect of this procedure, we develop an excess skin on the corner of the jawline that we name jowls, and we have a depletion, or we cannot define the jawline anymore. Today we're here for a facelift procedure.
That's correct.
All right, so how are you feeling?
Very relaxed.
So we'll do that at the local anesthesia here in the office, right?
Awesome.
Perfect. So no general anesthesia, no sleeping, nothing.
Nothing.
And what we try to correct, we're going to try to correct this excess skin on the jowling area, the neck, and of course a little bit the mid-face, that we're going to combine that with some fat grafting.
Perfect.
All right. So mainly what you can see here, you can see this area of the jowling, the non-defined mandibular angle, of course some excess skin on the area of the neck, and we will do that through a small approach anterior to the ear, extending, turn your head a little bit, posterior to the ear like that. How do you feel overall? You feel excited?
Yeah.
Are you scared?
Not at all. I've been waiting for this for 3 days now. It's like we should have done it last week.
Perfect. Let's go do that.
Let's do it. It's easy.
This is a condition named dermatochalasis with a ptosis of the skin, and we grade this dermatochalasis in different grades. Facelift patients nowadays, they start from the age of 40 to the age of 60, 70 and more. What we try to correct with the facelift? With the facelift, we try to elevate the face in a more superior position and to attenuate and remove the excess migration of skin, or the excess skin that migrated to a lower position, giving a better contour and a better aesthetics of the face. Most of the time we combine these procedures with the volumizing procedures of the face, like fat grafts or different other materials that we can use to volumize the face and give the more youthful appearance of the face. It's a small procedure that can perform under IV sedation. You don't need to go to sleep for this procedure. Mainly we have different types of facelift. In our practice, we pioneer a new technique of newstylelift. What we normally do, we work on the underlying tissues, the skin and the subcutaneous tissue, as people know it as mass. What we do, we elevate the underneath muscles and fascia to a more superior and posterior position, and then after we give a good contour and aesthetics of the face, we remove the excess skin. This procedure is a minor procedure. As I said, can be performed under IV sedation. The patient will remain in the hospital for 1 night or even can return home the same day. Most of our patients, they return to their work in a period of 2 weeks. So we're a day after facelift, full facelift.
Yeah.
We've done that in the office with local anesthesia. Can you tell me, did you have any pain during the surgery?
No, none whatsoever. For what you did, nothing at all. Nothing. You can feel movement, you can feel tugging, but no.
And you took your car and you went home.
Yes.
And now you came back by yourself.
Yep.
to just take out the drains.
Yeah, little bit stiffness, you can be careful with your neck, but as long as you're careful, there's no problems. No pain, no. Stiffness, yes. And the stiffness needs, you need to get your brain to say, yes, I'm stiff. Not pain, but stiff. You just need to, but it's, as I say, it's getting better by the hour, which is crazy. So you can feel yourself slowly, but it's come up a lot from here from what it was in UC. It needs getting used to, for me now, to know what it's like to have tight skin again. That's
Back to normal. And you feel wonderful, like you say.
Yeah, I feel.
Not yet, but yeah.
I will. I can feel. I will do. It's an experience. It's an experience.
So the first day after, it was okay with you. No big discomfort.
No.
Sleeping wise, is okay.
Sleeping wise, you have to sleep vertically, nearly sitting up. Not used to that. But you're living on a lot of adrenaline. You know, you're still excited, you're still nervous, but.
And as I can see, there's no bruising at all.
No.
A day after, and you're not getting
You put a lot of makeup on you.
Yeah. And as you can see the stitches here. Some areas that they're going to just take out the drains. And no bruising, as you can see. That's a day after. In a week, we take out the stitches, and everything will be back to normal. So we'll see you back in a week.
Sounds good to me. Thank you.
Are there any scars related with this procedure? The scar is being camouflaged by position intra-auricular inside the ear on the front part of the face and posterior to the ear on the back part of the face. Performing this type of surgeries, we do not have an obvious or conspicuous scars that may disturb your face. Are there many complications related or associated with these procedures? Mostly, this is a very safe procedure. There are plenty of complications, but the statistics are on our hands and they show a very low possibilities of complications associated with this procedure. This is my patient today for fillers on the cheeks. We finish up with the facelift. You can see the patient about a month of the facelift, and now we do a little bit of augmentation of the cheeks in order to give more definition of the face. We use radius, so you can see the nice definition of the cheeks, very good elevation of the mid-face, and of course augmentation that gives a new impression of the mid-face without having any extreme disfiguration. Who is a good candidate for a facelift procedure? Every patient who has a biologic aging that shows significant ptosis of the mid-face and lower face can benefit significantly from a lifting procedure that will rejuvenate and re-establish the contour of the face. Do we have any disfiguration and face changes with the facelift? Not really. Performing a good facelift, the facial features will not change. The patient will remain with the same features and characteristics, but without the aging signs. Are smokers a good candidates for this procedure? I will say smoking is always a bad habit and is associated with many complications with any surgical procedure. Though, with our new techniques, we can perform plenty of facelifts in a group of smokers, and we publish in the international literature many articles prove that the risk of smokers is quite a bit higher, but not an absolute contraindication for this procedure. For more information about this procedure, you can visit our website at www.cyprusfacialsurgery.com.